Hey there everybody, Seja here, founder of the School of Evolutionary Herbalism. And I recently got a question from a student about what types of herbs would be helpful for a condition that I had never heard of, right? This is a condition referred to as postural orthostatic tachycardia syndrome, as a part of it being dysautonomia, which is, I had never heard of these before, right? So obviously I didn't know how to immediately answer the question. And this led me to do some research into this condition, find out what it is, what's going on, and from there be able to translate, what types of remedies might be an effective course of treatment. Obviously, might being a key word there because I have never treated this before. I don't have any experience with it. But I wanted to share my answer to her question with you all. Because some of you might find, the information relevant for those of you that might have dysautonomia or POTS, the postural orthostatic tachycardia syndrome. But I think on a bigger picture, like more of a meta level, I wanted to share this with you because it is an opportunity for you to see kind of just my process of looking at a condition or a disease or a symptom that I've never really heard of and reading more of the conventional medicine's understanding of it, what's going on within the organ systems and the tissues and even biochemically, and how I take that information and translate it into, okay, here's the main herbal actions, categories of plants, energetics, and even potential specific remedies that could be beneficial at addressing that condition. I think while the information specifically on dysautonomia and POTS may not necessarily be super relevant to everyone watching this video, I encourage you to look at it from a higher perspective as a process for figuring out what to do when you get those hard to treat cases and are facing a condition that you have never treated before. I think it can be really easy for herbalists to get very overwhelmed, to get very intimidated when someone comes to them with a conventional medical diagnosis of something they've never heard of or something very serious. And either they get overwhelmed and are like, I don't know what to do, and get really stressed out and nervous about it. And sometimes that leads them to the point of referring that person to someone else before they even attempt at treating it. And I think it's very important for us as herbalists to know our limits. It's important for us to know what is the scope of our practice, right? Are we just helping our family, or are we helping our greater community, or are we in a clinical practice? But there's always levels that we kind of are striving towards as herbalists, and the only way we can kind of level up is by taking on something new, taking on something we've never treated before, taking on a tougher case, and not just referring them out all of the time. Now, obviously, it's important to know when to refer someone out, but it's also important to know when it's time to kind of step it up and face a new challenge and learn something new, and hopefully be able to help someone with your plants. So enjoy this kind of talk here on this condition, and hopefully you'll learn something new, not only about that, but about how to find what kinds of remedies you would use for a condition you've never heard of. And of course, if you are not subscribed to the channel here, be sure to do so. Just take the second to hit subscribe, whether that's on the podcast or on the YouTube. And whether that's on the podcast or the YouTube channel. And if you are watching this anywhere other than the blog, be sure to head on over to evolutionaryherbalism.com/blog for the full article and other resources and stuff there. And with that, enjoy this post here on this very unique medical condition here. So question number one is coming to us from Wendy Bennett in Alchemical Herbalism. And Wendy is saying, I'm seeking information on herbal treatment for dysautonomia in the form of postural orthostatic tachycardia syndrome, aka POTS. I've had symptoms for over 40 years and have recently been properly diagnosed. I suspect it is an extremely relaxed tissue state. How might the herbs help with POTS symptoms such as palpitations, blood pooling, and dizziness? So yeah, thanks for the question, Wendy. This is actually not a condition that I'm familiar with. So actually, as I was going through all the questions, I was like, whoa, I have no idea what that is. So I did some preliminary research on this, and I just thought I would take some time to educate everybody on this, because this actually is a surprisingly common symptomatic pattern. So what I'd like to do is I'm just going to read some information that I pulled from Johns Hopkins medicine, and I'm going to set my computer on my lap so I don't have to crane my head around. So I'm just going to do some defining here. So dysautonomia. Oh, I think it was spelled slightly incorrectly there in the, yeah. Dysautonomia refers to a group of medical conditions caused by problems with the autonomic nervous system. This part of your nervous system controls involuntary body functions like your heartbeat, breathing, digestion. When the autonomic nervous system doesn't work as it should, it can cause heart and blood pressure problems, trouble breathing, and loss of bladder control. So the autonomic nervous system is governing basically everything in your body that happens, quote, automatically, right? i.e., not under our conscious control. So, you know, we don't have to control our heart beating. We don't have to control the secretions of bile from the gallbladder. We don't control a lot of things happening in our body, but our autonomic nervous system does. You know, breathing is an interesting exception because breathing happens on its own accord, and yet at the same time we can consciously control it. So breathing is a little bit different. So yeah, dysautonomia is, or autonomic neuropathy is relatively common. Worldwide, it affects more than 70 million people. It's a lot. It can be present at birth or appear gradually or suddenly at any age. It can be mild to serious in severity and rarely can be fatal. It affects women and men equally. So it can present on its own as its own disorder or in conjunction with other diseases. When it's on its own, that's primary dysautonomia. For some reason, that is a difficult word for me to say. It can also occur as a condition of another disease, which would be secondary dysautonomia. Secondary can come alongside with things such as diabetes, Parkinson's disease, muscular sclerosis, rheumatoid arthritis, lupus, Sjogren's syndrome, sarcoidosis, Crohn's disease, ulcerative colitis, celiac, vitamin B and E deficiencies, HIV, Lyme's disease. Okay, so primary symptoms vary from patient to patient. Some symptoms may appear at a time of physical or emotional stress or can appear when you're perfectly calm. Common signs and symptoms are balance problems, noise and light sensitivity, shortness of breath, dizziness, lightheadedness, vertigo, swings in body and skin temperature, difficulty swallowing, ongoing fatigue, nausea and vomiting, GI issues, fast or slow heart rate, heart palpitations, brain fog, mood swings, weakness, large swings in heart rate and blood pressure, fainting, sleeping problems, migraines, dehydration, frequent urination, erectile dysfunction. This is like a huge list. I mean, this is kind of one of those diseases that anyone can probably be like, well, I might have that, because it's like these are things a lot of folks struggle with. So the thing is here is that postural orthostatic tachycardia syndrome, or POTS, is a specific type of dysautonomia. And so what this is a disorder that causes problems with circulation, causing the heart to beat too fast when you stand up. It can lead to fainting, chest pain, and shortness of breath. So basically what that translates, POTS, is postural, so that's relating to the position of your body. Orthostatic, meaning you're standing upright. Tachycardia, increased heart rate. Syndrome, a group of symptoms. So basically what this is when people are standing up, a lot of the blood is pooling in the lower parts of the body. And it's leading to palpitations, and then we see things like fainting, dizziness, brain, difficulty focusing. You're just not it's what in Southern blood typology, traditional medicine would say is low blood, right? The blood is not getting up into the upper parts of the body. So the heart rate does increase. In most patients with POTS, the structure of the heart itself is normal, but it's arising from a combination of lower amount of blood in circulation, excessive pooling of blood below the level of the heart when upright, as well as elevated levels of certain hormones such as epinephrine and norepinephrine. When we stand, gravity pulls more blood into the lower half of the body. In a healthy person, to ensure that sufficient amount of blood reaches the brain, the body activates several nervous system responses. One such response is releasing hormones that tighten blood vessels and cause a modest increase in heart rate. This leads to better blood flow to the heart and brain. Once the brain is receiving enough blood and oxygen, these nervous system responses settle back to normal. In people with POTS, for unclear reasons that may differ from person to person, the blood vessels don't respond efficiently to the signal to tighten. As a result, the longer you're upright, the more blood pools into the lower half of your body. This leads to not enough blood getting to the brain, which can be felt as lightheadedness, brain fog, and fatigue. As the nervous system continues to release epinephrine and norepinephrine to tighten the blood vessels, the heart rate increases further. This may cause shakiness, forceful or skipped heartbeats, and chest pain. Some people with POTS can develop hypotension, a drop in blood pressure with prolonged standing. Others can develop an increase in blood pressure when they stand. So there's many different types and causes. Some of these would be neuropathic POTS, which is because of damage to the nerves, which are the nerves that are regulating the contraction of the blood vessels. Hyperadrenergic is a term associated with elevated levels of norepinephrine. Hypovolumic is a term for abnormally low levels of blood, so not enough blood in circulation. And secondary is associated with other conditions known to cause autonomic neuropathy, such as diabetes, Lyme's, or autoimmune disorders. So that would be also a dysautonomia. So we've got a whole list of symptoms, and there's a lot of information here. On Johns Hopkins. I like Johns Hopkins. I think they're a good medical, institution. Actually, when I was initially in my undergraduate, my plan was actually to go to Johns Hopkins School of Medicine to study either neurology or cardiology. And then a plant woke me up. And my life was forever changed. So I just wanted to share all that with y'all because I was actually unfamiliar with this condition. And I figured a lot of you all probably were too. So what do we have here? So basically at the root of it, we have a neurological condition, right? We have a neurological condition whereby nerve signaling is not effectively constricting blood vessels. Because the blood vessels are staying dilated, more blood is pooling into the lower part of the body. We're not getting enough blood to the heart and to the brain. So the body releases epinephrine and norepinephrine, these adrenal gland hormones, to stimulate the system to get that blood up, right? And then you probably start feeling stress, anxious, nervous, and the heart rate increases. So at the root of it, we have a nervous system issue here, right? And whether that is maybe there's not enough neurotransmitters to effectively constrict the blood vessels, maybe the receptor sites are insensitive to the binding of those neurotransmitters, and so the post-binding effect isn't happening. There's something wrong there, like something's not working there. So to me, at the root of it, This is a more of like a depression tissue state, a depression of the nervous system. Like it's not, its functioning is lowered. It's not doing its job effectively. There's a lack of responsiveness, right? Which is one of the core indications of the depressed tissue state or cold. It's a lack of responsiveness. So what do we do there? Well, I think at the base level, nutrients are very important here. So we need to make sure that there are good baseline building block nutrients for the nervous system. So, just making sure there's a well-rounded diet. I would encourage supplementation with just a good solid multi-mineral and multivitamin to make sure there's adequate nutrition. Like your nervous system needs building blocks to manufacture these neurotransmitters. So that's a good place to start, I think, very basic level. From there, and of course this is a new condition to me. So I literally am learning about this like just now. So none of what I'm saying, so I guess in a way what I'm saying is take what I'm saying with a grain of salt, because I'm not saying like, herbal research on POTS shows that these are the most effective remedies. So basically what I'm sharing here is just based off of my, as you can see, very limited understanding of this condition. But I think speaking to more general herb categories, I can share some specific examples of remedies that I think could benefit. I feel like I'm always talking about nerve tropho restoratives, but we are talking about a functional nervous system problem. And so herbs that help to restore and strengthen the nervous system, I think will be very fitting here. So top three, again, milky oats or Avena sativa, skullcap, Scutellaria lateriflora. I believe St. John's wort will be very effective here, Hypericum perforatum. I think that remedy could prove to be very beneficial, as this is considered a neuropathy, and St. John's wort is a very specific plant for neuropathy. So nervous system restoration, I think, is very important because this condition, we're seeing an increase in epinephrine and norepinephrine secretions over time. As you're saying, it's been happening for 40 years. I would say there's probably a degree of adrenal fatigue here. So some adaptogens could prove to be very beneficial there to help replenish worn out adrenals, so to speak. I would recommend ashwagandha here because it's also a nerve tonic. Some eleuthero couldn't hurt, probably. Perhaps some of the ginsengs or Cotinopsis would be worth looking into. And you just don't want to, and then rhodiola might also be worth looking into, especially because it's good for suboxygenation, or hypoxia. So category 1, nerve tropho restoratives. Category 2, adaptogens. So these are really working, the way I see it, more on the core, right? The foundational issue there. For more of just the symptomatic side of things, I think we're looking at circulatory stimulants for sure. We're trying to get the blood up, right? We want to get the blood up. So the adaptogens and nerve tonics, I think, are going to be better for hopefully restoring the nervous system, restoring the body, so that it just remembers how to get the blood up on its own more effectively. Obviously, this sounds very uncomfortable, probably alarming, potentially dangerous, especially if you stand up and like walk down some stairs and then get really dizzy. We don't want to fall down the stairs and things like that. So I think some symptomatic relief goes a long way here. The categories I would suggest would be circulatory stimulants. Okay, prickly ash, I think, is going to be key here because prickly ash works on the prickly ash works on the kind of the junction between the nervous system and the circulatory system, right? It's diffusive. So it works through the nerve. It's a very good remedy for nerve pain, but it's a very good herb also for poor circulation. So I think that Prickly ash, I think, could be a very specific remedy here because it's hitting both sides of it. Like, this is a neurological issue that's affecting circulation. So prickly ash, I think, is a major remedy. That would be Xanthoxylum clava herculitis. And that is the bark, right? Prickly ash bark in tincture form would be a very good place to start. Any circulatory stimulant, I think, would probably be beneficial here. Valerian, or not Valerian. Well, Valerian may not be a bad idea because it is a circulatory stimulant to the brain. It's a cerebral stimulant, is how the eclectics talked about valerian root. So cerebral stimulant, bringing blood up into the head. But it is quite calming, and if you're already fatigued, valerian may not be the best choice. But more importantly, cayenne pepper, our classic remedy to, as the old North American doctors described it, it equalizes the circulation, okay? So through equalizing this is what we're seeing, is there's a disequilibrium in the distribution of blood throughout the body, right? It's pooling low. We need to bring it up. So we're looking at pungent, spicy, hot remedies that move the energy up and out, right? We need to bring the blood up and we need to disperse it out to the periphery, to the head, to the brain, to the nerves, right? We're trying to move that blood up and out. So I think cayenne's a critical remedy here. Other circulatory stimulants that could be considered: angelica, archangelica is nice. Angelica sinensis would probably work well too. Especially if we need to build the blood, the dong quai would be good to help build the blood. Which, it does sound like this condition could be due to a lack of blood, but it's really more, it's just not in the right spot. Ginger, good remedy to consider here. Now, one of the main things here is, okay, why is the blood pooling low? Well, blood vessels aren't constricting. So this is where and it's funny because usually with herbs, we're talking about vasodilators, right? Where we're wanting to get blood, where there's lack of blood flow because the veins everything's constricted down, and we want to dilate it and open it up to bring blood to an area. But what's happening here is that all the vessels are overly relaxed. So you're right, Wendy. It is, in a way, a relaxed tissue state. But at the core, I think it's cold, depressed tissue state that is then leading to a relaxed tissue state, right? So all those vessels are relaxed, and so the blood can't return. So we want astringents, right? This is where we use circulatory stimulants that also have an astringent property, like things that you would use to treat varicose veins, I think would be very applicable here. So Aesculus hippocastanum or horse chestnut, I think would be a very good remedy to consider. Yarrow or Achillea millefolium would be a good remedy to consider here. Those are the two main remedies that I think of that really stimulate blood flow, but also have a very nice astringent effect. So those two are worthy contenders here. But really anything that's going to tonify blood vessels will be helpful. I really just pretty much use horse chestnut. Oh, the other remedy that can be used here is Colinsonia or stone root. This is a old North American remedy used oftentimes to treat gallstones, but also liver stagnation and blood stagnation. It's an astringent, but it's also a circulatory stimulant. Colinsonia could be a remedy to consider there. It's not a remedy I personally have used very much, but based on the pattern, it could be a fitting remedy here. So I'm just sharing options. Obviously, look these remedies up, do your research, make sure it fits. From my understanding, lots of people have this, manifest this condition in a wide variety of ways. So please select the remedies that are most suitable for you. And And then the last thing is if the heart palpitations are, really serious, obviously this is because of that stimulation from an excess of epinephrine and norepinephrine. So, which, again, it's a vital response. The body's like, hey, come on, heart, like get that blood up there. So hopefully with the circulatory stimulant and tonic astringents in the vessels, that will help get it up. But get the blood up, that is. But the remedies that I would consider for just the acute heart palpitations, just to help settle the heart, you might consider lemon balm, Melissa officinalis. You might consider Leonurus cardiaca, motherwort. You also might consider Tilia europea or linden blossom. Those are the 3 remedies that I've recommended to folks for heart palpitations, and they are pretty reliable. Sometimes the dosage needs to be dialed in from person to person. Some people, we find very low doses are effective for a heart palpitation, 5 drops. Especially with Leonurus, that plant seems to be quite active in low doses. Lemon balm, I find a little higher dose is good, but others, they need 2 dropperfuls, 60 drops, 2 mils, to get a good effective dose going for them for the heart palpitation. So those are some recommendations that you might have. And those they're nervine, so that'll be nice for the probably excess stimulation. From so much epinephrine and norepinephrine being secreted. So that is helpful too. But boy, if you're really fatigued and tired, they're maybe not the most ideal, but they're mild. So I can't imagine it being too intense and like making you feel very fatigued. So, okay. So I think these, and then, so it's like I think about blood flow into the brain specifically, and immediately it's like, oh, ginkgo. But ginkgo is a vasodilator, and I think we want to avoid dilating the veins anymore. So I would avoid ginkgo. You might consider gotu kola actually, I think would be a very good plant here as well. Very good nerve remedy, nerve tonic. Connective tissue tonic with astringent properties and brings blood flow to the brain. So that would be a very fitting remedy here. Gotu kola, it does combine very nicely with Bacopa, Bacopa mineri, which also brings blood flow to the brain. These 2 would probably be helpful for the dizziness. And getting that blood up into the brain. So I think, let's see, horse chestnut, yarrow, cayenne, prickly ash, gotu kola, rosemary, maybe with a little bit of lemon balm or tilia in there for the heart palpitation could be maybe a good potential starting place for a formula. Obviously, I'm just like literally doing this in my head, so you are hearing me think out loud, but this is my process. I think this is like on a bigger picture. I think this is a really good thing for you all to be able to see as kind of my process of, like this is what I would do if you were my client, Wendy, right? Is you would present the case. I would get an understanding of what is going on. And obviously I have a very limited understanding of what's going on specifically to you. But then it's like, wow, I've never heard of this condition. I'm going to read up on this condition. I'm going to see what the physiology is, what the pathology is. I'm going to see what organ systems are affected. I'm going to see what the main symptoms are. And I'm going to start translating that into, okay, what are the energetics going on behind this, right? So we're seeing relaxation, we're seeing some cold depression, we're seeing lack of circulation, and so then what that does is then it helps me start saying, okay, these are the main categories I want. I need some astringents, I need some circulatory stimulants, I need some nerve tonics, right? And then okay, what herbs in those categories are going to be the most specific? Oh, gotu kola, that's got some specifics here. Prickly ash, that's got some very specific qualities here. Horse chestnut, right? So these remedies are kind of what are hitting multiple layers of the pattern that makes them very optimal candidates for your remedy selection. So I'm just mentioning that because I think this is a really good exercise for herbalists to kind of understand and see, because it can be really easy for an herbalist to just, oh, I've never heard of that condition, I've never treated that, I'm going to refer you to someone else. And it's like, no, this is a great opportunity to learn more and to understand how to treat something new. And I think it's good to take a conventional allopathic medical diagnosis and work with that, right? Like that's great information because now we have an understanding of what's going on a physiological level behind these symptoms and can form a more effective course of treatment. So hopefully that helps, Wendy, kind of start to, orient you in a direction to further your studies and research on this and find some remedies that will be most suitable for you. I hope that is helpful, and good luck. Please keep us updated in the student portal on how everything is going with your healing journey and what herbs you're finding to be effective, or formulas and things like that. And for everyone too, I just want, hopefully that was helpful in illustrating kind of the process there of working with a conventional diagnosis, translating it into energetics, thinking through our categories, and starting to figure out what remedies would be applicable there. So yeah, great question there, Wendy.